Hello, I'm Carrie. I'm a nurse practitioner student, and I'm going to do a cardiothoracic exam along with peripheral vascular. I'm going to start with your peripheral vascular. We're going to feel the arms all the way down. Temperature is normal. We're going to check the radial pulses. They are a +2. They are not bounding. They are not diminished. Check the brachial. If the brachial was impalpable, we do an Allen test with clenching the fist and letting go of one side. We have brachial hair distribution is normal. There's no scarring. There's no visible veins. Well, varicose veins. Fingers have good cap refill and good blood flow. No clubbing. Go ahead and relax your arm. No notable axillary lymph nodes. Go ahead and relax. If there were, you would mark tenderness, redness, size, mobility. Go ahead and relax that hand. Again, no axillary nodes. Go ahead, relax. I'm going to start with the legs, just for our privacy. We'll start here. Temperature all the way down is warm, symmetrical. Arms also were symmetrical. We have a +2 dorsal pedal. We'll have a +2 tibial posterior. Go ahead and just relax your legs a little. Popliteal pulse is a +2. If they were bounding, we'd be concerned for aortic insufficiency. Cap refill is good. Checking for edema on the tibia. No noted edema. I'm going to squeeze your calves. Any pain with squeezing?
No.
Perfect. We're going to move up to the head. Head of the bed is going to be at 30 degrees with the pillow just under the shoulders, with the neck back. Looking at the neck and crowded, we are symmetrical. I don't see any bounding pulses. I'm going to use index and middle at one at a time. I'm going to do crowded pulse, grade at like a +2. Amplitude is normal. It's brisk. It's smooth. Go ahead and feel the other side. Again, it's brisk. It's smooth. Any pain?
No.
I'm going to go ahead and listen to your carotids with the bell. Rule out any bruits, which would be a disrupted blood flow in the carotid artery, which puts them at risk for cerebrovascular accident. I'm going to have you take a breath in and blow out. And hold it, please. Perfect. I'm going to do the same thing on the other side. Big breath in and out. And hold. Perfect. Relax. Now we're going to move on to the chest. We're going to inspect. When we look, it's symmetrical. No abnormalities. I'm going to feel with a hand, checking for lifts, heaves, no pulsatile aorta. Then I'm going to check with my fingers. Again, no lifts, heaves, thrills, which would be significant of hypertrophy of the ventricles. Also comes into grading your murmurs. We're going to locate Erb's point. We have the sternal notch. We come down about 5 centimeters to the ankle. That puts us at the second rib. Leave one finger there, and we go down to about 4th, 5th intercostal. This is what we call Erb's point. It's the right ventricle. Significant of could be any pulmonic hypertrophy or increased pulmonary pressures. If we go down and out from the midclavicular line about 5 to 7, I'm going to use my middle and index fingers here. We're looking for the point of maximal inspection, the PMI. We're just going to check for a diameter, make sure it's under 2.5 if it's larger. Again, we're looking at hypertrophy or left ventricular issues. If you have troubles, we would rotate to the lefty cube side. That would displace the ventricle closer to the wall. And now I'm going to go ahead and take a listen to your heart sounds. And start with the diaphragm, which picks up higher pitched sounds. We're in an aortic, where the aorta comes off the ruling out murmurs. Significant of valvular disease. We're at the pulmonic. Usually you should hear an S1, S2, S2 being a little bit louder, sometimes a little pause with inspiration. Now we're at Herb's point. Go on to the tricuspid. And down at the mitral. If you can go ahead and just lean to your left side a little bit, we're just going to roll out some mitral regurg. Sometimes you can hear it a little bit better if you move to the left DQ. No notable murmurs. Amplitude is brisk, it's smooth. Go ahead and roll back over. I'm going to go ahead and switch to the bell, which picks up the lower ones, usually from Herb's point and down. It works a little better. Good. No murmurs. If you had a murmur at the aortic, it would be aortic regurg. Mitral is mitral regurg. Valvular disease. Alright, now I'm going to have you go ahead and move to the end of the bed and sit up, please. Again, I'm going to listen to the heart sounds. Aortic, pulmonic, Herb's, tricuspid, mitral. Come back, lean forward a little bit. Take a big breath in, exhale and hold, please. And relax. Good. Just a quick listen on the bell. You can just stand real quick. We'll do the same. All right, why don't you go ahead and have a seat back down, please. Next, we're going to move into the lungs. We didn't do the jugular, just the JVD measurement, did we? All right. I'm just going to take a look. We're going to do the accessory muscle use from posterior view. It's unlabored. It's easy. It's calm. It's symmetrical. No adventitious lung sounds. I'm going to feel and palpate any pain, broken ribs, crepitus, air. I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
Using the palms, 99, vibrations present and symmetrical. I'm going to do some percussion. We hear resonance, which is a normal sound. It's expected. A dullness would be fluid. A hyper resonance would be air. Okay. This 7th rib under the shoulder blades. We're going to come out to the 10th rib. Put my fingers together. Please take a deep breath in. We have about a 2 centimeters. If it was greater than 3, go ahead and relax. Be significant of lung disease, often COPD with a barreled chest. Looking at the chest ratio, we're at a 1:2, which is normal. If you were greater than the 1:2, again, it would bring us back to the COPD with the barreling of the chest. I'm going to go ahead and listen to lung sounds in the back. Breathe in and out. And have your mouth open. No adventures lung sounds, no rock eye, no wheezing, no crackles. Scores are fine, which would be significant in fluid in the lungs or congestion. Wheezing with asthma. I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Same thing. I'm going to have you say E.
E, 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 E,
And E.
E.
All right. This time through, we're going to do 1, 2, 3, 4.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Great. You can relax. We do the 99 to rule out any excess air that we would hear, and it would be like a muffled 99. We do the E to make sure it doesn't sound like an A when we're listening, and that would be we consider consolidation of the lung or pleural infusions. We do the 1, 2, 3 to make sure again that there's not a loud 1, 2, 3, which would be significant of air, extra air. I'm going to have you take a big breath in and hold it. All right, relax. I'm going to have you take a big breath in and blow it out and hold. We have about a 4 centimeter mark. Sorry for marking it back. If it was greater than that, again, we would look at into COPD and the overexpansion of the chest, which yours is normal. I'm going to go ahead. You can go ahead and lay back for me. We're going to come back to an anterior inspection. I'm just going to do this. I missed the JVD measurement earlier, so we'll throw that in there real quick. I'm going to turn your head just a tad, thanks. At the greater pulsation, I'm going to put a corner right there. Come down from the sternal notch in the clavicular line. We're going to measure this out. I'm just a tad over 1 centimeter, which was normal. If we were closer to 3 or 4, that's significant of a hypervolume state in the increased central venous pressures, often with heart failure. And now I'm going to take a look at the anterior chest. It's smooth, it's symmetrical, unlabored, equal rise and fall. I'm feeling. I don't notice any pain, any crepitus, no broken ribs. We're going to do another percussion, okay? First I'm going to percuss out the heart, starting at the mid-clavicular line. This we're just checking for the borders of the heart. Make sure it's not enlarged with hypertrophy and left ventricular failure or heart failure. Good. Up here, we're going to start with the lungs. We hear a normal resonant sound. Again, if it was hyper, it would be air. Don't expect dullness over the heart. If it was dull, it's either an organ or fluid. Good. We have the infraclavicular nodes and the supraclavicular nodes. No tenderness, palpation, redness. All right, we're going to start with 99.
99, 99, 99, 99, 99.
Great. Vibration present and symmetrical. I'm going to go ahead and take a listen. We're gonna start with normal. You can leave your mouth open. Alright, go ahead. And okay. Alright, we're gonna repeat on the back side. We're gonna start with the 99 and go into E and 1, 2, 3.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great. Now with the E.
E, 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 E.
1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Alright, go ahead and relax. No adventitious lung sounds. There's no wheezing with asthma, no rhonchi with congestion, no crackles with fluid in the lungs or pleural effusions. 99 was present. It was not exceedingly loud, looking for extra air. E sounded like a clear E. It was not turned into an A, which can happen with consolidation and fluid. 1, 2, 3. It was not exceedingly loud. It was a normal faint 1, 2, 3. Other than that, I think that is it. Let me just run through and double check while we're here. We checked for no varicosities.